a crisis that probably affects someone you know. More and more people are addicted to opioids or pain pills. It's so bad that today President Donald Trump declared a nationwide public health emergency for opioid abuse. Our Jory Talley talks with two people on the front lines of this crisis today. She joins us live in the studio with more. Jory.
The people who work at community counseling know the problem all too well. Opioid abuse can result in addiction, long-term treatment, and even death. It's easy to get hooked, and in some cases, even easier to get the pills.
You may have an old bottle in your medicine cabinet. Painkillers like Loratab and hydrocodone fall into the class of opioids, joining even more dangerous drugs like morphine and heroin. Medication is easy to access, and it's not illegal.
It's not like I'm going out buying marijuana or buying cocaine or buying meth. I'm going to the doctor. He writes me a prescription. It's perfectly legal for me to get a prescription from a doctor, but however, I'm taking it and abusing that because now that my medical condition cleaned up, I want to feel better about myself.
Columbus Police Assistant Chief Fred Shelton believes some doctors may be writing too many prescriptions for pain pills. He says other doctors have strict rules.
Some medical officers tell you we do not prescribe pain medication, and there's certain criteria that you have to meet to get the pain medication. So I think at least in that respect we're taking some responsibility.
And some people who become addicted to pain meds will doctor shop to get the prescription.
The classic things when you look at signs of addiction is I use more than I intended, right? I find myself setting boundaries and then not being able to stick with them. The classic sign is that once I start, I'm unable to stop.
These are other signs of addiction. Changes in behavior and health, along with frequently thinking about the pill. Kenan Wald, Director of Alcohol and Drug Services for Community Counseling Services, says addiction is isolating.
By not reaching out, there is a lack of support that they're going to find. And so shame and guilt kill more people in addiction than drugs, right? An inability to reach out, seek help. And there's a lot of people out there that are working and living with this and doing well, right, in recovery and managing their life.
The emergency declaration means here in Mississippi and Alabama, the government can expand medical services in rural areas. It's a tough road to recovery. If you or a family member are fighting an addiction to pain medication and you want to share your story, let me know. You can email me at jorytalley@wcbi.com.